Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 6 new cases of COVID-19, bringing our total to 230. We are announcing another death today. This is a gentleman in his 70s from Winnipeg with underlying medical conditions. This brings our total deaths to 4. And I'd like to pass on my condolences to their family and friends. As of this morning, 10 individuals are hospitalized. Of that, 5 are in ICU. We are reporting 92 individuals listed as recovered, with 134 current active cases. Public health investigations are continuing to confirm details, and our information will be updated on the website as data becomes available. Again, caution Manitobans that these numbers over the past few days, while maybe showing us that our efforts are working, we cannot interpret them as a lowering of our current risk. Now is not the time for us to loosen up our activities. We need to continue to focus on social distancing and all of our strategies going forward. So although we don't want to see our numbers increase, it would be a mistake to interpret this as lowering our risk right now in Manitoba. I've mentioned that this weekend, these next few weeks are critical in Manitoba's response to this pandemic, and now is not the time to loosen our efforts. We don't have to look far to see the impacts of this virus around us. We can look to our neighbors in the south and even many jurisdictions in Canada right now seeing case numbers climb and as well, unfortunately, deaths. So we need to stay vigilant in Manitoba, continue our efforts. We have some early signs that may indicate that our social distancing strategies having an effect. Our public health response, the case identification, case isolation and contact tracing may be working, but we cannot let up on any of these activities. It's vital that all travelers returning to Manitoba self-isolate and monitor for symptoms for 14 days after their return to Manitoba. The majority of our cases continue to be connected to travel. All international travelers are required to self-isolate for 14 days upon their return under the Federal Quarantine Act. This act has very stringent penalties for contravention. All travelers returning from Canada returning to Manitoba from other parts of Canada also are required to self-isolate for 14 days. Self-monitor symptoms, if any, should develop. Call Health Links for further advice. And our message has been that now is the time to be staying home. So certainly now is not the time to be traveling. Cancel all non-essential travel. This is not the time to travel outside of Manitoba. It is the time to stay home, and that includes not traveling to the cottage, not visiting friends, not having family dinners. Now is the time to double our efforts to stay home to interrupt the transmission of this virus. We've asked the Manitobans now for a number of weeks to take these significant precautions, and it's challenging, but we have some early indications that they may be paying dividends for us. But it's way too early to conclude that, and it's way too early to loosen up on those activities. Manitobans need to stay home, especially when they're ill. And that includes any mild symptoms, even runny nose, cough, sore throat, certainly fever. If you're ill, stay home, especially if you're a healthcare worker. But we need to interrupt the transmission of this virus, and staying home is our best bet at that. Frequent hand washing, certainly coughing into your sleeves, And if you must go out for necessities and physical distancing is difficult, then you could consider wearing a non-medical mask as well in public. This virus is currently in every health region in Manitoba, so no Manitobans should feel safe from it right now. All Manitobans should be practicing social distancing at all times. So that includes staying home for the most part. That includes not leaving your home except for essential duties, not leaving your community except for essential reasons. We can all do our part to limit the impact of this virus. So I've had clear advice going into this weekend that I feel that this weekend, in addition to these next couple of weeks, are really critical in our response. And it's absolutely true. And so with this weekend, nicer weather, many holiday gatherings are traditional. But I want to say in the clearest words possible that now is not the time to have family get-togethers. Do not invite family over for Easter or Passover. Please do it virtually. Please stay connected. Social distancing is not social isolation. Make sure we're connected, especially with vulnerable groups. But now is not the time to host family get-togethers. Now is not the time to go to faith-based ceremonies. Now is the time to stay home. Do those things virtually. As some of the messaging has been evolving over time about the use of masks in public, where certainly there is likely benefit to others if you wear a mask in public. Certainly our medical grade masks, we need to save those to be in the hands of our healthcare workers. But other masks are likely to protect those around you, unlikely to protect the person wearing them. Certainly hand washing is your best bet against this virus. But we're also hearing reports of increasing litter and improper disposal of this type of PPE. So I'd certainly discourage that. If you choose to wear a mask in public, please dispose of it properly. We always remind Manitobans to access credible information. Fear and stigma can drive an epidemic. Knowledge is our best weapon against an epidemic. Visit our website, manitoba.ca/COVID-19, for up-to-date information. And our message is the same. We have all of these challenging strategies in place right now for Manitobans. And the reason that they're there is because there's evidence in other jurisdictions, and there may be early evidence in ours that they work. We are not helpless against this virus. Our actions are having an effect. But we know if we loosen up on those actions, this virus is still there to start transmitting and causing increasing issues in our province. So we need to now double our efforts, continue to stay home, continue to practice physical distancing, and together, working together as Manitobans, we can limit the impact of this virus in our community. So thank you very much, and I'll pass it to Lanette.
Thank you. Good afternoon. I wanted to begin today with an update on the contact tracing investigation that was underway at Selkirk Regional Health Centre. As you will recall, a healthcare worker at the facility tested positive a couple of weeks ago after returning from travel in another province. This triggered a public health contact tracing investigation to identify healthcare workers and patients who had close contact with the COVID positive individual. Those identified were required to self-isolate for 14 days from the last day of contact with the individual and to self-monitor for symptoms. That period has now passed, and I am able to confirm that staff members who were on self-isolation have now been cleared to return to work, and all additional tests for COVID-19 that were completed as part of this investigation have come back negative. So this investigation is now closed. There are a few takeaways that we can learn from this case. One is the importance and the effectiveness of the public health advice that we have been given to all Manitobans. Social distancing and proper hand hygiene are so important in preventing the spread of the virus. The results of this investigation show that vigilance of staff in Selkirk really did help to prevent the spread of this virus. Secondly, it demonstrates the importance and the effectiveness of the robust public health contact tracing process. Working rapidly to identify everyone who had been exposed and ensuring protocols were put in place really are our best tools in reducing the spread of this virus. So I want to say congratulations to everyone in Selkirk. Your dedication to patient care and your professionalism are appreciated by all Manitobans. We also spoke earlier this week about the need to offer appropriate location for those experiencing homelessness in Winnipeg to isolate safely when awaiting test results or after testing positive for COVID-19. I am pleased to announce that such a facility is now open and is available on a referral basis. It's a 39-unit site, and the first 10 beds opened this morning. Now, people without homes can be referred directly to this site while they await lab results or if they are recovering from the virus. Nursing and support services will be available to individuals staying at the unit during the day. This resource would not have been made possible without the efforts of End Homelessness Winnipeg, Manitoba Housing, Main Street Project, and the WRHA working together with other community partners. A special thank you also goes out to Palliser and Defresne Furniture, EQ3, and IKEA for donating furnitures to outfit the units. I also just wanted to give an update on the Dynacare reporting negative results. So we have an update in the process as from yesterday. So the guidance that I've been given is that if you have not received your results 7 days after the test, and you have not heard back from Dynacare, then you should be calling your primary care provider. Do not call the testing sites, do not call HealthLinks, call the healthcare provider in your region. And finally, we know that maintaining personal connections with our friends and loved ones during this pandemic can be very challenging, and it becomes increasingly difficult for our friends and family who are in hospital or other healthcare settings. Whether they are being treated for COVID-19 or some other issue, a hospital stay can raise feelings of anxiety at the best of times, and we know today it can also be lonely. Today, more than ever, patients across our province need the gift of connection, the ability to reach out to their loved ones and have important discussions. And they need the gift of distraction from their anxiety and their symptoms and feelings of loneliness. So while our care providers are working hard to heal and manage their symptoms, supporters like the Grace Hospital Foundation, HSC Foundation, and Children's Hospital Foundations are looking for solutions to create a sense of connection. We have talked previously about the efforts from both HSC and Children's Hospital Foundations, and today I would like to highlight the Grace Hospital Foundation's purchase of more than 20 new iPads for use of patients in that site's COVID unit. These iPads will allow patients to maintain contact with their support network and provide the necessary distraction to pass the time. It's a great initiative that will definitely help patients at the Grace. Hospital foundations in Manitoba work tirelessly to address the needs of patients, staff, and volunteers. Their work is continuing and very valuable during COVID-19. So we would like to thank the Grace Hospital Foundation and all other charitable organizations that are doing their part to help Manitobans get through this pandemic. And with that, we will open the line to questions.
Thank you. A reminder to our reporters online, you'll have one primary question and one follow-up, and please introduce yourselves. From CBC Manitoba, Bart.
Hi there, barbecue to CBC. Thanks for working today. What is the plan to ensure that homeless or other at-risk people who are gathering in large groups outside places like Lighthouse Mission and other places in the inner city are distancing? The message doesn't obviously seem to be getting through to people without access to media, conventional or otherwise. What is the province doing to ensure those people are not gathering in large groups?
Well, I think a lot of it is about messaging. We've been quite connected with all of those areas, and working with them to see what kind of things can be implemented there to enhance the physical distancing in there. It's difficult. We know that there's a lot of challenging times for a lot of Manitobans, and then there's some that are quite vulnerable. So there's been a lot of work to try to address that, and then certainly if we are screening or detecting a case, then we have things in place to certainly be able to isolate them from others.
What can you tell us about the National Microbiology Lab infections? Unofficially, this does not sound like it came from within the lab. It was brought to the lab. Can you please comment on the significance of the facility that is doing vaccine research for the entire planet coming down with infections and people in isolation?
Well, I think it's important in certainly in any of our critical workforce, right? Our healthcare workforce, including areas like that we do not allow this virus to affect the supply of our healthcare workers. So I don't have any specifics to mention there. I haven't been updated on what the contact investigation looks like with anything specific. But I think the overall tone is that we want to take extra cautions. We have a lot of people working in critical areas that not only are important, obviously, to their health, but to all of our health. So it's it's something that we're definitely following up on.
From CTV Winnipeg, Jeremy.
Hi there, Jeremy Sherrill from CTV Winnipeg. I'm wondering, the city announced this morning that firefighters and paramedics will be now wearing reusable masks, different masks than they have been, to free up N95 masks for healthcare workers. I'm wondering what your reaction is to that, and if it's encouraging to hear a move like that, and how much of an impact that has on those healthcare workers.
So so I mean, I think that we know that PPE, personal protective equipment, is really in demand throughout the world right now, and certainly that translates into Manitoba. So anything we can do that continues to protect the workers, but also preserve supply is essential. And so certainly the N95s are in high demand, and so we want to ensure that N95s are utilized when required. But in most instances in healthcare field and contact with clients, the N95s aren't required. So, I think that we're all going to need to ensure we're using the PPE efficiently.
Thank you. And my second question, as the messaging continues for people who are thinking about gathering over the long weekend, and you guys are continuing to remind people this is not the time, what's the message for any cottagers, anyone that was hoping to get away for the weekend? I know there's been strong messaging about refraining from doing this in the past, but perhaps even more people are looking to get away. What's your message to them?
Yeah, and it's, the message is the same, and it translates into all of these types of things, and it's to stay home. That's your best protection, and that's the best way to protect everyone around you. Best way to protect Manitobans, best way to protect our healthcare workers is to stay home. And it's a nice weekend, it's a holiday weekend. Lots of traditions go on. So I know that travel might be one of those traditions. Large family gatherings might be one of those traditions. But this is not the year. This is the year that's changed a lot for many of us. So we have businesses that are struggling right now. We have people struggling with childcare because kids, school has been suspended. So there's a lot of Manitobans doing their part here, and I think if Manitobans stayed home for the most part, we're going to continue to interrupt the transmission of this virus. So I think that's the messaging that translates into a lot of these specific activity requests is stay home.
From City News, Jonas.
Good afternoon, folks. Jonas Gilbart, City News. QP put out a release today after a survey they conducted with their employees, and over half at least say that they're not comfortable with how they've been prepared and are not comfortable with the amount of PPE available. Do these results surprise you guys, and what can you do to mitigate this?
It does surprise me a little bit, but sometimes what happens is we have done a lot of preparation to develop education and awareness. It's on our website. We've got videos. We've done quite a lot of work, and I give the credit to infection prevention and control and staff health in developing those materials to make sure staff are safe. If it's not getting to the worker on the front line, then we certainly can follow up with the administration in particular regions and talk about how we can get that communication or demonstration or whatever they need. And I think in terms of having the PPE that they need, we certainly understand that there is a challenge. We've been hearing it. Right now we have shipments going out every day. So I guess the best I can say is that I will continue to work with the leaders throughout Manitoba, and I would encourage the workers to be talking to their direct reports and advocating for what they need, and sometimes it may be patience getting the supplies to them. But we have provided some guidance, we've provided supplies. More is coming. As we get more shipments and deliveries in, we'll continue to be flowing the supplies. And I think if they're concerned, I would like to continue hearing that and working towards resolving it.
Follow up on the homeless center that will be established. This is an existing facility, I assume, that is being retrofitted. Can you give us a little more details on the facility and what it will look like?
About this new one that was announced today?
Yes, please.
Yeah, so I believe, I don't have the details. Do you have that?
Mm-hmm. No.
I think it was an apartment block at one time. I'm not sure of the details. I can get those for you, but you're right. It is, it's a existing space, and that we're going to dedicate to this population.
From the Winnipeg Free Press, Ben.
Hi there. Thank you guys for doing this on a Friday holiday. I just wanted to ask, it's been roughly a month since the first cases have been announced in Manitoba. A bit short of that, but we are now at the point where it's been a month and we can look back at the actions we've taken with a bit of a longer lens. I'm wondering if you could comment about how the province responded early on and whether those actions were strong enough or if we waited a bit too long to take serious precautions such as reduced crowds and reduced for increased social distancing?
Yeah, so it's I think it's early to take a look. I think that we sure could be looking at the many more cases still in our future here. So certainly this is not the time to let up on any of those strategies. I think if you compare us to pretty much any jurisdiction, we acted quite quickly. Now that's also benefit of our geography and the timing of this, but we implemented social distancing recommendations on the day of our first case. And so I think we moved quickly. There's some evidence that some of our actions have had an effect. But again, I don't want that to be misinterpreted that our risk is low right now. I think we need to continue to implement these social distancing strategies to stay home for the most part. And I think we're going to have to double our efforts. We're going to have to continue with these stringent policies, these stringent requests of Manitobans, because that virus is still there, and we're still in a very critical stage of our outbreak right now.
And just as a follow-up, I know that the man who died this morning, you said he had a pre-existing condition. I just was wondering if you could tell us a bit more about that situation specifically. Was he in hospital already? And was he in isolation from other patients? Can you tell us a bit more about that?
I'm sorry, this was regarding the death that we reported today?
Yeah.
Oh, right. Yeah, so a gentleman in his 70s who was hospitalized and certainly a known case, and so was in appropriate isolation.
From Global, Merrick.
Hey, Dr. Roussin, Merrick Cash Global News. You guys announced an additional death today. I was just wondering if the person who died had any connection to any of the other deaths or cases.
I'm not aware of any connection.
Okay. And my second question is, the government has requested N95 masks for frontline workers, but are there any circumstances or reasons where these masks wouldn't be taken?
When they wouldn't be taken?
Like, wouldn't be accepted by you guys?
Well, I think if they come from an unknown source, they would probably go through some review of infection prevention and control and staff health. That has been our process before, just to make sure that they're up to standards to keep our staff safe. But for the most part, we will accept anything, and we will evaluate it and put it out into distribution.
From the Brandon Sun, Drew.
Thank you. This is Drew from the Brent. We've heard reports that there is a possible outbreak or a respiratory illness outbreak at a care home in Swan River. I'm just wondering if the province was aware of anything of that nature.
No, I have not received any reports of such an outbreak, and so I'll certainly follow up on it. If there is, then the usual steps are taken. So public health will identify the case, identify contacts, put in any necessary public health interventions. It's just a matter of whether the specific report gets to me or not.
And also, will the province be releasing the details of where the people who recovered are?
I don't, I don't think that was in the plans. We have the number of cases that are reported by region, and so the recoveries are just a later curve, a 14-day later curve from that. So we could look at that. I don't think that was in the plans.
From CJOB, Diana.
Good afternoon, Diana from 6ABC JOB. Just a question on the fourth death here in Manitoba. From the looks of it, this man was in the ICU just based on numbers. Are you able to confirm that and say if he was at a personal care home or a seniors residence prior to entering the hospital?
This gentleman did spend time in the ICU and was originally from a personal care home, although the public health investigation looked like not in the infectious period while at the personal care home.
Okay, so no other residents at that care home are suspected to have COVID-19 right now?
Not as a suspected contact to this individual. Not that I've known as through the contact generated by this individual.
From the Winnipeg Sun, James.
Good afternoon, James from the Winnipeg Sun. My question is in reference to a European study that suggests COVID-19 has spread far beyond officially reported numbers. If that's the case in Canada, is there cause to believe that fatality rates are being overestimated because they are based on test results rather than the actual number of people infected with and recovered from COVID-19?
Yeah, so it's a good question. So, I mean, the case fatality rate by definition is the amount of deaths divided by the total number of diagnosed cases. So certainly if you look in areas, in regions where they have tested extreme amount of people, even asymptomatic people, then it will drive down your case fatality rate just because your denominator is so large. You know, so it's possible that the case fatality rate could be overrepresented if you're missing a lot of these. So we know that there are, in some studies, many undocumented cases, and you tend to expect that with any type of outbreak. You're never going to diagnose all of them, but what you do is you do set up to look for the indicators of that. And so one of those indicators is hospital admissions. And so we test all hospital admissions for COVID-19. We test all ICU admissions for COVID-19. And so we're not seeing those numbers climb now. We're seeing our positive test proportion decline over time. So all those indicate that we're not likely missing some hidden epidemic right now. And in saying that, we have to continue our efforts. We're going to continue to expand testing, but we also have to encourage Manitobans to continue all the work with physical distancing that they've been doing already.
Thank you.
From CBC Radio Canada, Laïsa.
Laïsa Pamou, CBC Radio Canada. My question would be about the Center for Homeless People. Maybe just where is that center located? Also, what is the process to be admitted into that center?
So we're not giving out the exact location of the site at this time because just to keep privacy for those people who will be there. And in terms of the referral process, I believe they will be referred through public health. So if you are a positive case or a contact of a positive case, you will get a referral to stay in that location.
Thank you.
All right, for our reporters online, we have time for a few more questions. Do we have any other questions?
Yes, please. Dr. Roussin, Bartlett-Davis here at CBC. Could you break down the ICU patients at HSC versus St. B just in terms of numbers?
No, I don't have that in front of me. I did have a breakdown in some of the age range of the ICU admissions in total.
Would love that. Go for it.
Yeah. So the age range goes from the 50s to the 70s. It was actually 90% males. These are total cases. This is our 10 total cases in ICU. 80% of our admitted ICU patients had hypertension. And so many of them had many underlying medical conditions, but we find that hypertension, cardiac related issues are very prominent in ICU admissions in many jurisdictions. If we look at hospital cases, there's been 21 total admissions, and that age range goes from 20s to 80s, with 2/3 being males. And most of them having underlying medical conditions, most notably respiratory and cardiac, as well as diabetes.
Thank you.
Diana from 680 CJOB. Just a question on the testing. Yesterday, it looks like there was a big increase in the number of tests on CADM. Is that due to the expansion of the testing criteria? Were there kind of a bunch of first responders getting tested yesterday? Are you able to say?
Yeah, I'm not able to say. I would be surprised if that was a large proportion of those tests, just that we announced it yesterday. So I think throughout we've seen a fluctuation in number of tests over time. So I don't know exactly what that fluctuation was yesterday.
Merrick to Cash Global News. Should Manitobans expect to see a jump in numbers given we are expanding testing?
Well, I think that our test positivity proportion is declining. So I think even with that, the more you test, the more you find. But again, noting that we're not seeing an increase, a dramatic increase in hospitalizations or ICU stays, it's unlikely that we're missing a large epidemic. But we're going to continue to increase that testing. But things like Manitoba's efforts on social distancing, as well as public health's rapid ability to identify cases, isolate those cases, and in the very extreme contact tracing and management are all contributing to this. So we're going to continue all those efforts. But like I said, it's too early for Manitobans to feel good about these numbers. It is very, very likely that these numbers are going to increase over time, and so we need to stay vigilant.
We have time for one or two more.
Jeremy here from CTV Winnipeg. I'm just wondering, the opening of these homeless self-isolation spots, is this in reaction to demand? Have you guys seen a lot of cases at shelters? What is the reasoning behind opening this?
Yeah, it's part of our preparation that we want to be in front of. We know that the risk is higher for people who live and eat and sleep close together in close confines, and maybe have underlying chronic diseases. So to my knowledge, there's been no one who's been diagnosed in a shelter at this time, but it's just really about preparation, and we don't want to be scrambling at the last minute in case something does happen. We want to be prepared, and we want to be organized and make sure we can keep people safe.
Dr. Roussin, Bartley Keepus here at CBC. The city of Winnipeg is using out-of-work recreation employees to do education. Don't you think? What do you think of the idea of actually having staff, provincial, city, whomever, approach large groups of at-risk or homeless people and try to disperse them so that they don't put each other at risk?
Yeah, so I think that's part of having those orders in place. So I think over time the ability to enforce is there. I think starting with education, starting with visibility, is the best way to do this, because I think most Manitobans are complying, and I think most Manitobans want to comply. We just have some that may not know the importance yet. So I think that visibility out there and the messaging can certainly improve, and I think that will help out. And then we certainly want to make sure we don't, in this messaging, further disadvantage the disadvantaged. Which tends to occur when we have any of these outbreaks or public health issues. So this is why we've been working with some of the shelters, why we have these isolation centers. So we want to make sure we're reaching out to all Manitobans.
And that concludes today's media briefing. Thank you.
Thank you.
Thanks.